No, this is good. And actually, we just hit the 50 mark, which is great. So for everyone that's joining, hopefully you can. I'll ask for some verification. Can everyone see the Empower screen, slide, background, healthcare session? Perfect. And what we'll do is, this is meant to be low-key, low-stress networking session. I'll describe the background of how this all started. We've got about 45 minutes. We'll have a couple polls, some interaction along the way, and we'll go through an awesome use case experience with Stacy Kerr. She's here with us now. And then we'll open it up for Q&A. And if everyone is up for it, please feel free to activate your web camera to try and make it as much like a in-person, face-to-face interaction networking session as possible. You don't need to. But everyone should be in control of their own microphone too, just a heads up. So when we get to about 20 minutes, we'll get to the point where we'll open it up and people can, chime in. But until then, if you want to potentially just maintain awareness of whether or not you're broadcasting any sound, that'd be great. Let's do some quick background. So I'm going to move a few things off of my screen. So when this all started, Jen Paulson, one of our team members who's helping to coordinate the greater Empower conference that is this year, kind of asked about hosting some networking sessions in San Diego. Said, not a problem, that's awesome. Networking sessions are always great. You get people face-to-face interaction, and then you get some spontaneity on sidebar conversations, right? Oh, hey, by the way, and you start to build a network. And what's great about Empower, and I bet there'll be a ton of head nods here, especially from the team, the group we have here today, is that most people familiar with QuickBase or associated with QuickBase, they are what we have kind of put in the subject as the doers, the playmakers, the catalysts. You might call them champions. They're typically, you boil it all down, they're typically leaders, right? People that get stuff done, which is awesome. That's what QuickBase is really good at, and that's what's awesome about this kind of the greater ecosystem. So after we transitioned to virtual environment, Jen said, you know what, we don't really have it may not be a great forum for a networking session. So we said, we'll probably push those off to the side, and then came back and said, well, actually, we'll host a few of them. Can we have some teams that would be up for kind of guiding these virtual conversations? And here's the team in front of you. Basically, what we're going to do is we've got some slides. Not a huge fan of slides, nor do we think that slides, because sometimes they can constrain what you're trying to accomplish, especially in a networking session. But quick overview of the agenda. So we'll do some introductions, some official introductions. We'll cover Stacy's Peace Health experience, which is going to be inside. The only thing we've asked from Stacy is true candor. So we've rehearsed transitions of slides and polls and audience interaction. We have not rehearsed nor even gone through Stacy's responses to some of these questions we have queued up. So I think that will be awesome. We think that will be awesome. And then we'll open it up for the Q&A, questions and answers portion at the end. So free form, and that's where we can try and get to that face-to-face interaction, even though we're not in person. So if you've got a web camera up, you can ask a question. Stacy can see you, the team can see you, you can see us, right? And then closing comments and connecting. Basically what we'll do is through our poll experience, we'll offer all attendees, all audience members to participate in contact exchange. So nothing will show up on the screen. People won't be exchanging points of contact right here, right now, but we'll capture those that want to participate. We'll be able to consolidate them into a distribution list. And then after this event, probably later today, it might even be later this week, we'll send those out in kind of like a blind carbon copy distribution email. Just for the intent of a networking session, it's to connect industry professionals, the doers of the community. And that's what we'll try to do today, just to give everyone the full background, okay? So to kind of kick off and progress through to get to the meat of this material, we've got about another, give or take 35 minutes. Introductions. So speaking, I'm Corey Hoppus. I'm a member of our solutions consultant team. Got another team member of our group, Brian Fogg, on, and then some other QuickBase members that are going to be here to support. We've got Jacob McIntyre. He's one of our senior managers for our customer success team, and you'll hear why they're on. We've got Molly Boschel. We've also got Marissa Newmeyer. And the reason why we have this group from QuickBase is because much of this group has been a part of that implementation experience for Stacy. Stacy is the true star of the show. Focus on her today. But why, Stacy? We asked the team to join. Is that way in case there are any questions about, hey, what was that Quick Start program like? What was that augmented implementation experience like? You can get some of those responses from the QuickBase side too. And we've just asked for pure candor back and forth. Without further ado, Stacy, what I'll do is we'll hold this slide, and if you'd like to do an introduction, please feel free.
Hi, sure. I am Stacy Kerr. I'm a program manager at PeaceHealth in our IT transformation office. It's a new office, and my role is to help manage different programs and projects that transform help to transform and kind of bring our IT division just to more maturity. And so my background, I came from HR from PeaceHealth for a few years and managed projects and programs from benefits to then jumping into an application analyst position where my job was to manage our PPM system, which was 10 years post-implementation and many admins later. So I came into a system that was just kind of a mystery to a lot of people. So I learned it, and then we got a new CIO, and that CIO, from the moment he saw our current system, wanted something new. So I had kind of a several year cycle, I guess, of going through many application demos and reviews and requirements gathering, and just to come up with what our solution was. And that's how we came to QuickBase.
That's awesome, Stacy. Thank you. We're going to dive more into that here in just a moment. But before we do so, this is where we'll try to. We realize we might not be the first event. I guess yoga was the first event today, so we're the second event to Empower Conference. What we'll do first is say, if we can get, we want to encourage engagement. So let me do this. I've got to do a few screen transitions here to get to, if anyone's ever used Menti before, basically what it is, it's a live method online of encouraging interaction between like virtual conference members, audience members. So I'm going to transition my screen, and hopefully now everyone can see a Menti.com, use the code 792326. This question should be live. So if you were to go to Menti.com, use the code and start inputting, awesome. That's exactly it. That's what we want to see.
Cool.
So we'll give this about a minute just to see where everyone's coming from. And basically this word web, right? The more responses we have from the same answers, and it'll present larger. So Atlanta's kind of leading the charge right now, Eastern Seaboard, but here we go, yep. And I realized, Jacob, I can't input my Portland. Oh, I see one Portland, yeah. But if I move my screen, then we lose the word web, so.
It's all right, we're on there. We're representing.
Yeah, put a pin on the map. So it's kind of neat. And then Stacy too, this kind of gives you an idea too, as we share your experience, this truly is networking at its finest. We're speaking to greater teams across the entire country. So we'll just hold that up there for a moment. I'll pause that there. And that way, to everyone who's joined, thank you for your time. Now let's get into the real meat of it. And I'm going to transition back to our PowerPoint slide. Hopefully everyone, let me know. Stacy, does it look like we're back?
Yeah, you've got the Menti poll up.
Perfect. Thank you, ma'am. And PeaceHealth experience. So before we start lining you up, Stacy, just to reiterate, these are unrehearsed responses. I've got a little bit of an outline for some questions that I think, just in case we need some guidance. I don't think we're going to need the guidance. I think it'll come naturally. You already mentioned, so we'll have the conversation we'll hold this for about, let's see, so we're looking at almost 11:45 Eastern time, so about 15 minutes. Now I'll leave us another 10 to 15 minutes for open Q&A at the end. So new CIO came in, indicated that wanted to look at a new solution, right?
Yep.
So you mentioned you spent a couple years looking
Yeah.
at solutions. Is that true?
Yes. So so our CIO came from a background where QuickBase was prevalent. He was an early adopter of QuickBase, so he was already someone who wanted that solution. However, he was also new to the organization, so didn't want to just come in and force a new application in, and respected kind of the process. And we started to, so part of my job is also to help manage governance of IT investments. So helping our system services in different divisions request software, and when we got requests for PPM software, that would come to me, and so I'd start collecting. And yeah, it took 3 years of, at least 3 years of work to get to a place where we got approval, and that was going to governance. I think we went to governance twice before, and that being our getting approved by our CFO. And really the question was, each time was, how can this scale to the organization, and how, who else is involved in this request? And when we're making this type of investment, we want to be able to make sure that we have a focused on enterprise solutions that can be used everywhere. And we started to get a lot of different requests for project management and just kind of workload management.
Okay.
And so once we really dove into the needs assessment, and we looked at a lot of software, and we looked at, once we started thinking about low code, we looked at a lot of different low code options too, and found that that there's a variety of low code vendors, but they're also, their expectation of their customer is different. So
Okay.
by that I mean, some really did require a bit more knowledge of code and build and kind of design. We wanted to make sure that a nurse manager could come in and build something, that they don't have a code, like any sort of kind of technical background other than, I mean, their focus is care. They don't want to spend time on technology. So we needed something that was super easy for across the board. And so because of that, and some low code vendors just totally opted out altogether once we gave them all of our requirements, and they just didn't think that they would be the solution for us. So
Okay.
we came around to QuickBase, which of course our CIO Will was very happy, and but he was also pretty, I think, nervous because he's such an advocate. He didn't want the perception to be that he pushed that upon us. So we were very diligent about reviewing all of our options, and we wanted to present the low code option as a tool that could solve a lot of application problems, meaning when we get application requests or software requests, we could say, could it be done in QuickBase first before we start looking outside at a different solution? That was too broad. So that brought us to our initial objective of, okay, we're going to request QuickBase to build an enterprise PPM solution where 16,000 employees could access it, and we could be nimble enough that it could serve the purpose of 10 different divisions. So that's a really long-winded story about how we got to QuickBase and kind of our initial objective.
Which is awesome, and that's where we're just taking the responses in. 16,000 employees. Okay, I'm sure a lot of audience members are thinking, when did that start, that experience of implementation, and where are you now, and where do you think it'll finish time-wise?
Okay, so
Putting her on the spot.
it started in September. So we signed at like the Labor Day weekend, I believe, because I
Last
remember
year.
being in the grocery store. Yep.
Right. Okay.
Taking cell phone calls to sign contracts. And yeah, so we signed, and then we had our first, so we signed and we did sign up for the quick start. That was another thing, Will, that our CIO was really adamant that we could do this really quickly, and because he knew what QuickBase could do, and he wanted us to move fast. And I felt like part of our success in doing that would be the quick start and getting support from QuickBase. So Jacob and Molly and team came over, and we spent a few days together and hashed out our workflow. And because of just all the work we'd been doing, we had a lot of sample reports. We had a process already kind of established on paper, and that was like halfway used in our old system. And so that was September 18th, I think, was our first on-site. And then we had reports built, and all projects moved into QuickBase by the blow your mind date of October 1st. So that we set a blow your mind date, and that was it. And we met it thanks to a lot of work that Brian Ogg did, I know, and Marissa and Molly and Jacob all working behind the scenes to get things set up. So we moved over 250 projects that were in flight into QuickBase and began the reporting process for our governance. So we have about 6 or so reports that we wanted to have available for our executives to review.
So I'm going to ask this because I always try to put myself, if I'm an audience member and I'm joining and I'm hearing this for the first time, and we're going to get a chance, right, in about 5 to 10 minutes for audience members to ask their questions. But you're telling me 250 projects within 2 weeks went into a new solution. My big question, if I were sitting in the audience, I'd raise my hand and I'd say, well, Stacy, what was the biggest challenge? Like, I mean, there's tons of challenges to do that, but you're going to have stakeholders, right, who are going to be using a new system, and you're informing them, hey, a new system's coming, and they know you're going to start the implementation, and then 2 weeks later, they should be using it. So they probably have some high expectations.
Yeah, there's a lot of anxiety. So the way we inform people along the way, but we also have, so my peers, other program managers, are those who kind of manage, we have 5 different portfolios of projects.
Okay.
And we started with just building an IT model. So it was focused just solely on our IT division because we already had these processes in a system to replace.
Okay.
We did development sprints. So our first sprint was, okay, we need to stop managing projects in our old system. Excuse me, we need to stop entering new projects in our old system, and we need to start entering any new projects into our new system. So that was kind of our first stopgap. So any existing projects still were, so we ran parallel with our old system for about 4 more weeks. So by the end of October, we were 100% into QuickBase for status reports, milestones, and general, like replacing what we were doing in the Clarity old system.
Perfect. Yep. That's not our focus here today, by the way. Yeah, other solutions, we're keeping on QuickBase, but thank you for sharing that. Yeah.
Sorry.
No. That's perfect. Yeah.
But yeah, so we just went through to, so I broke it down into sprints so that we could manage the development and replace functionality in kind of bite-sized pieces.
And with that, which seems then super logical, efficient, probably, user adoption would probably be ramped very well with that, which is, it makes sense why you guys took the approach. How about now? So that was back in end of October, right? It was when we looked to have everything cut over.
So yeah, so then we turned to look at resource management. So that was another big lift of development work that, so we had to build timesheets for, excuse me. We had to build timesheets for our IT caregivers to track the time that they're working on projects and time that they're working on other like maintenance items or operational sustainment, break fix type things. So that was the next push, which we went live with January, the first full week of January. So yeah, so basically we had a 100% replacement of an old system by January. What was that, 7th something? 3rd?
So would that be, you had replaced 2 systems at that point?
No, that was all in one system.
That was, oh, that was all in one system. Okay.
That was
okay.
all contained within our old PPM. We ended the use of that system in January. So yeah, so 2.5 months.
I mean, that's, it's hard for me not to laugh out loud in a positive manner just because of what you've accomplished. And for the greater audience, this is why as soon as Jen said, hey, by the way, we think we want to do a healthcare one, immediate response, Stacey already knows this. Yep, I think we've got a great person to be able to give some insight about taking on a heavy lift and just approaching it at rapid rate of speed. And then, reach out to Jacob too and the greater team is like, yeah, of course, absolutely, we'll join. So with that being said, rip and replace the full solution, by middle of January. My big question, again, I always like to look at it from the other side of the fence, and that everything is going super well. It sounds from that share. What was not super well? I would want to know what was just something that still gives you headaches when you think back on, or if it still gives you headaches today.
I think it's just with rapid development like that, we're not taking the time to optimize. So we got the bare minimum done to get over the hump of getting out of the old system, but then there's so much that can be done with that tool. Like there's just the amount of reporting and the visibility that we're now able to show with what we've forecasted to what what our caregivers are actually booking against projects, and being just so I think that was the biggest drawback of going so fast. So okay. Now so basically once I got through once we got through the resource management piece and the time management, then we started further developing the project management module. So yep. We wanted something so we had kind of a framework initially with the first app that we built. And so by this time we're in our 3rd app that's project management, where we're in the time tracking piece. And that's when we engaged with our PMO manager to start developing and owning the project management kind of tactical pieces. And so he's been learning and developing and building out kind of more of that project management detail and managing that side. So having another person involved, and I think, and his background is development, so he has we're on totally 2 different spectrums of experience, where I am not a technical person. However, I like logic and I like how things come together. So I do really like the way QuickBase works, and I understand it for the most part. But
you do.
For his perspective of just more development and database management, it just, I think there's a different learning curve to come into that, because he's trying to make it fit into what his experience is, and whereas I have nothing to relate it to. So this is what it is.
This is such a good description, and as we've been talking going into this, I knew that I'd be able to just have this, you and I could just have this conversation, and this could go on for hours just because of your experience and just my genuine interest. I'm keeping a track on time, and I'm sure Liam's probably sending me a bunch of messages that I haven't read yet. We've got about just over 15 minutes left. I want to ensure that we actually can open this up to the audience members. If nobody has a question, Stacy will keep it going all day, but I'm sure people have questions. So let me do this. I'm going to just transition.
And I'll add one more thing just to wrap up the end of, so kind of the end of the story is COVID happened. And that, so for 2.5 months, I have been turned my attention elsewhere. And right at the point where we were about ready to start piloting and launching this suite of applications to the other shared services division. So right now I'm getting back into this space and kind of working on the template that they'll have as an application template, and kind of rethinking what my plan was before and how we can even move faster now.
So many questions just on that shared services, because that's going to open up, how many use cases and the users and adoption, but I sometimes overwhelm the microphone. So let's do this. I think we've got quite a few participants, just judging by what I see on my screen. Again, you don't need to share your web camera, but you should have control. I think everyone should have control of their own microphone, and we might even I'll start looking through the chats, or Jacob, Brian, Marissa, Molly, if you guys had some questions that popped up that you've got queued up or earmarked, please feel free to chime in and introduce them. Well, it looks like we do have one in the chat that I saw. Ms. Kerr, do you still utilize QuickBase developers for new applications, or do you have QuickBase subject matter experts within your company now for new and upcoming apps? And this is coming from Christina.
So so that's kind of the space where we're in right now, is how do we govern and expand QuickBase? So that's also my kind of scope of responsibility to figure that out. And so we have not allowed people to just make new applications yet. We are working on the requirements that we will have for folks who want to build an application, which includes QuickBase training and what mainly, at least get through some of the basic QuickBase University pieces, and provide us a use case. Like, what's the purpose? Who are going to be your users? And I'm working on the request form in the feedback app that QuickBase has. I've added a table that will be a request form for those types of requests, and it will also include an acknowledgement of what it means for a builder to take on a QuickBase app. So while I love my QuickBase team and like to lean on them heavily because they know we've built something really awesome, I'm also trying to take off the training wheels and do the building and navigation kind of on our own, but definitely lean on them for some best practices.
That is awesome. Hopefully, Christina, that helped answer the question. If it didn't, or if you have more, feel free to chime in. We've got a number that are queuing up here as well, Stacey. So I'll keep going unless Christina jumps in or somebody else jumps in. We'll go. This is a pretty broad, great question. A little bit broad. So regarding the implementation of your project management use case specifically, biggest challenge, Stacey. What do we put at the very top? And you say, "Yep, that's it."
I think the biggest challenge is training and just keeping people up on the process. So I've used we do what are called confabs, just as an IT department, where it's kind of an informal training where we do a slide deck and a demo and we record those. And then I also have worked on leveraging the home pages within QuickBase to build instruction pages, but people have to read those. And so it's just being reminded that those are there. And then I think how fast things are changing, again, because we've done this so rapidly, once we began to use it, the expectation is that this is iterative and that we continue to build and refine. And so as we do that, again, making sure that the users know what those changes are. I think and then I think I might uncover different challenges as we implement this project management suite across the organization. There's going to be a lot more novice project managers, and just I think making sure that they have this tool that is intuitive and easy to use will be important.
That was such a great response, and this is why it's just real, because it relates to back to Christina, rapid development, introduction of a new solution, new tool. Christina said, by the way, she was in the healthcare industry, also looking at rapid implementation, so that probably hit.
Yeah. I mean, people were really floored by just how fast we were able to do this, and it's been valuable. So it's not, you're not just throwing out something that just because you've created something that is useful and valuable, and yeah, but the pre-work makes a difference. Having the workflow and design behind it was key for me to keep falling back to, because that's, I think people know the blessing and the curse of QuickBase is that you can do anything. Like, so it's a blessing and a curse, because just because you can, should you? And so those are the questions. And I think another key to the success has been that my manager gave me, I am the QuickBase project management person. So anything that's happening in our suite of applications has to go through me. And so I'm able to help make sure that we don't turn our application into what we had before, and where we had just too much stuff, too many fields that didn't make sense, that didn't apply, and whatnot. So
I can only imagine how many head nods you got. And Sean had asked a question about, just title in, Sean asked a question about overall project management. And then the next one coming from Richard. Richard had actually asked, and you used the term twice since Richard asked it, which is so perfect. He said, how do you decide between a small number of apps, so like focused rollout, implementation or adoption plan, versus the apps suite, that term you've been utilizing? So out of curiosity, did you guys go into it, hey, we're going to have a suite, we know we need to get there, that's a long-term end state, but right now we need to start small? I mean, how has that evolved?
I think through our quick start, once we talk through the use case, and Jacob, you might have to keep me honest here, but so we went through and through their help figured out that we would need more than one app to do what we wanted to do, but they all needed to be related. So and I have an image I can kind of share if you want to see.
Please, that would be great. Let me stop my share, and you'll have, we've got about 5 minutes, just so you know.
Okay, I will try to.
You're perfect. You're perfect.
So,
right, yes, ma'am.
So
gotcha.
This is what we ended up with, is this. So we have portfolio management, which is what was our first level. This is the intake of projects through project approval. The first iteration had risks, issues, milestones, and status reports. But as we continue to develop, our next piece was the resource management, and that was large enough because that's project capacity planning that has another connection with an employees table where we created kind of a hierarchy of our division.
Mhm.
And then we have project management, which is where our resources track their time. And then this is where we've moved those risks, issues, milestones, and status reports into project management. So that's the tactical area. And I think it just we had kind of distinct elements that we wanted in each app, but could connect them, is why we needed to kind of build more, and what I refer to as our suite of what we've dubbed Project Command. So, and then my dream state is this top part, which is enterprise reporting, where, so as we roll this out, we're starting everybody out with this level 1 portfolio management to the other divisions. And then as they mature, we will see if they need resource management or the more tactical project management piece.
That was awesome. Jacob, I know, thank you so much, Stacey, for sharing. Jacob, I saw you turn off mute. I know if you had anything to add, please feel free to do so.
Sure. Yeah, I think a lot of people ask this question, right? When do I know to make more than one app? When do I know how to take my monster ideas and turn it from 2 apps to 3 to 4? And you know, from a best practices standpoint, it's difficult to know that. That isn't always perfectly clear. We can't give a silver bullet answer to that. This is one of the reasons you have a QuickBase team as a customer, is to try to help you flesh that out. So what we did with Stacey, I think, was just take a look at the different functions that were needed. And once you get to a certain number of roles, a certain number of different, pages that you want people to interact through, to reduce the number of clicks on the user end, there's a lot of different variables that you kind of take into consideration and go, okay, that should be 2 apps. And those of you who have been around QuickBase a long time know that if you don't do that early on, you end up just adding tables and adding tables and adding tables, and then you have a Franken app. And so we were trying to it's the planful approach, and I think it was really kudos to Stacey and team to be able to see the larger vision, not only have that vision, but also have the sponsorship. And like Stacey said, she had someone saying, you are in control of this, so we're going to take this from a higher level. And I think that really contributed to the success of being able to have the vision and execute on something a little larger. Than if you start small, that's okay too sometimes, but then you end up stuffing that app with many, many more tables, and then you're kind of regretful a year later. So it was cool to watch that process from the beginning, and kudos to Peace Health and their team for having the ability and that forethought to say, let's do this right. Let's take our time, and let's develop something that's replicable across those departments. So it was really cool to be a part of.
Such awesomeness. And truly, for all audience members, by the way, Stacey's diagram, her representation share, we'd never seen it before. She entirely put that, like, that is just real, it's authentic. Stacey, one more question, and then we'll have to transition to the poll for the networking. I just thought it was a great question. Could be fairly upfront, it might even be a little bit more in depth, but coming from Leighton asked, and you might see it too, who updates the PMO app? So is it only like how do you do the governance? Managers and above, is there a position title and above, or?
Yeah, so we have portfolio managers. So we have 5 portfolios. Each has a portfolio manager, which is one of my peers from the program manager management transformation office. Okay. We shepherd the projects through the portfolio management app. So we will get the business case, and which ultimately I'm working on an intake so that the business champion who's trying to get this through will do that themselves. So we shepherd the project through portfolio management, and then once it's approved, we make sure that every project has a project manager, and it doesn't matter if they're from the PMO or not. It's just this person is the one ultimately responsible for updating the project, and so that's who's responsible for updating it in the project management app. From the resource management side, our TSP managers, so anybody who has a direct report that will be working on a project, they are responsible for like maintaining that, their records.
Perfect. That was awesome. And it only pains me to do this because, or I should say I'm pained because of our next action due to time. We need to transition and want to ensure, in the spirit of networking, this is where, let me transition this over to, okay, so what we'll do now is we'll start our last mentee poll for those that participated. Again, I'll bring up the screen here in just a moment. And then if you'd like to, this is where anyone who submits information, they'll be saying, yes, please feel free to distribute this among others who said they'd like to share. Nobody needs to participate, entirely voluntary. But that is what we thought at the heart would be networking. So let me do this and here, and I'm gonna present, and then let's transition screens. And Stacy, if you don't mind, or Greater QuickBase team, if everyone can, are you able to see the mentee? Okay. So I'll put that up. I'll just hold that there, and I'll just leave that on the screen actually, because I think we're probably just about a minute away. So Stacy, ask you first preference, I should say, and then Jacob, Molly, Marissa, Brian, if any comments at all before we disconnect.
I was just looking at the actual questions you had me prep to see if there's anything. I don't think that I have anything else. It's been a really fun experience, and just in general, the response from folks, especially coming from a really painful system to this, has been refreshing. And with COVID, we used QuickBase a lot to help build different incident command apps to manage tasks and data and provide reporting, which allowed visibility to a lot of others throughout the organization. So we had more people in QuickBase, which was pretty exciting too, just to get that people to see it do different things.
QuickBase team, any thoughts, parting comments? Okay. No?
Good.
Okay. Well, Stacy, we would like to say from all of QuickBase, we mean it. Thank you. Endless thanks. It's just that I just want you, that COVID topic, I could set up 2 hours on the calendar just to talk to you about that, because that is so real and so relevant. But yeah, and on behalf of all the attendees that have joined, thank you, Stacy, and then from the QuickBase team to the attendees, thank you, and hopefully Empower Conference day number 2, hopefully it goes well.